Today, we're discussing fatty liver disease warning signs, signs that are crucial to detect early to prevent the disease from worsening. The first sign is generalized symptoms like abdominal pain and loss of appetite. The pain is often felt in the upper right side of the abdomen. Another warning sign is fluid buildup in the abdomen, called ascites. This can cause abdominal fullness, bloating, nausea, and even difficulty breathing. Unintentional weight loss is another potential warning sign. While it can happen for various reasons, it's worth evaluating if it occurs alongside other symptoms. Muscle wasting is a more serious sign and is common in advanced stages of liver disease. Studies show that it affects nearly 40% of patients with cirrhosis. A major red flag is jaundice, where your skin and the whites of your eyes turn yellow. This happens due to excess bilirubin in the body, caused by poor liver function. You may also experience easy bruising or bleeding due to reduced production of blood clotting factors. Watch out for spider angiomas, which are web-like clusters of blood vessels under the skin. Neurological issues can also occur. This is known as hepatic encephalopathy. It may cause confusion, irritability, balance problems, or even personality changes. Other signs include dark urine, pale stools, and in men, breast enlargement. While gynecomastia can have other causes, it may indicate liver disease when paired with these symptoms. Lastly, look for dilated veins under the skin, which could signal non-alcoholic fatty liver disease. That's it for today. Let us know your thoughts in the comments. Don't forget to like, subscribe, and hit the bell icon for more health insights. See you next time.